Today, in addition to myself, we're going to have Dr. Gary WILTZ, who is the CEO of Teche Action Clinic and a member of the Health Equity Task Force. He will speak in a moment on the challenges of rural healthcare delivery during COVID-19. We also have Dr. Chip RIGGINS, who is the Region 3 Medical Director, which is South Central Louisiana, Lafourche, Terrebonne, St. John, St. Charles, and St. Mary. Very good. Today, we are reporting 1,137 new cases of COVID-19 across the state. That brings us to 135,439 cases since the beginning. Today's 1,137 cases were on 17,371 tests. About 30%, the largest age group for positive cases remains the 18 to 29-year-old group. We do have a little bit of good news again today. Some positivity decreased from 12.5% on August the 1st to 10.33% today. So over the last couple of weeks, we have seen modest but steady improvements on cases, on positivity, hospitalizations as well. Unfortunately, we haven't yet seen the improvements on deaths, and that's a lagging indicator. It stands to reason, and it's happened in our state before, and it's happened in other states as well, that at some point after you have fewer people contracting the illness, going into the hospital, and so forth, that will also show up in the death numbers. So while we're making progress, I want to caution everybody, this is not necessarily going to be permanent. It will be if we do what we're required to do, what we're asking the people in Louisiana to do, it will be permanent. Unlike when we had the stay-home order, the numbers improved much faster. That's not going to happen this time because we're paused in phase 2, and in order to get on top of the numbers, we're just going to implement more mitigation measures within phase 2, and then try to get better adherence to the restrictions in phase 2. It is working. We thought it would work. That's why you are seeing fewer people go into the hospital, to the emergency rooms with COVID-like symptoms. That's why you're seeing fewer positive cases. You're seeing reduced positivity, which is that percentage of tests administered that actually yield a positive result, and we have fewer people in the hospital. Today we're reporting 1,320 hospitalizations across the state. That's down from 1,600 on July the 27th. And so that's significant improvement. But even with those numbers, I want to caution everybody, we still have a very heavily burdened healthcare delivery system. We have 15 hospitals reporting 0 ICU beds available today. 11 hospitals around the state reporting 0 med-surg beds available. So it's a very difficult situation. What I can tell you is, had we not put in the mask mandate and the closed bars for on-premises consumption and reduced the gathering size, the number of people who could be at a social gathering, when we did, if that hadn't happened, we would be well over 2,000 people in the hospital today. That's the path that we were on. And even with the improvements, we still have a strained hospital system, both as it relates to bed capacity and staffing. And again, part of the staffing is we have so much community spread of COVID that we have doctors and nurses and respiratory therapists, phlebotomists, and others who are actually contracting the disease. And then they have to obviously isolate. They're not available for work, assuming they're not also in the hospital as a patient. Sadly, we're reporting 41 new deaths today. That's a total of 4,279. Now, speaking of deaths, I do want to update you all on the data we have regarding race disparities. While the statewide racial disparity in COVID-19 deaths is not as severe as we saw at the beginning of the pandemic, we know that there are disparities, and at the regional level, in some cases, they are more pronounced. You may recall we were the first state in the country to report the disparities in cases and deaths based on race. And at that time early on, and I can't remember exactly when it was, probably sometime in early April, even though African Americans made up just 32% of the state's population, they were accounting for close to 70% of the deaths. That is very different today. Right now it's 48.65% of the deaths are among black residents in Louisiana. And while white residents make up 49.35% of COVID deaths. And now look, obviously no one is immune, but African Americans are still overrepresented. And I think what this tells us is they are more likely to live in areas and work in occupations that predispose them to contracting the illness to begin with. And then once they do, there's a greater prevalence of comorbid health conditions that make them especially vulnerable to the disease, which leads to higher hospitalization rates and unfortunately to higher death rates as well. Those things being heart disease, kidney disease, hypertension, diabetes, and obesity, and so forth. So that's what we're working on. That's why we created the task force to deal with health equity in Louisiana. I think Dr. WILTZ is going to speak about that in just a moment. In fact, that moment has come. So I'm going to ask Dr. WILTZ to come up. If you've got a question for Dr. WILTZ, please ask him before he yields the podium. When he leaves, Dr. Riggins is going to come up and give you an update on Region 3. And again, if you have a question for Dr. Riggins, ask him while he's here. And then once he's finished, I'll come back, make a few more remarks about unemployment benefits and a couple of other things. And then I will also take your questions.
Well, good afternoon. And I want to thank You've done enough medicine in the last few months. I think we'll make you an honorary physician. I want to thank Governor John Bel Edwards for his leadership during this time of crisis, but not only during this time of crisis, for his leadership throughout. The last time I was in this room was when he signed Medicaid expansion. I clearly remember I was standing off to the right here. And because of that, I want to make that very clear on the onset. Because Louisiana had Medicaid expansion, even though we're in the middle of a pandemic, it could have been a lot worse. The 450,000 plus people that have access to care now, it would have been a lot worse had we not had that Medicaid expansion occur. So as he mentioned, I think we are on a more positive upswing. And that's directly related to the leadership and the mandates that were enacted regarding mask and staying in phase 2. I'm going to speak a little bit about the challenges we've had in the rural community. If you look at the way that things began, New Orleans was the epicenter, and then it spread like a wave. We have clinics in St. John. Just to give you some perspective and context, I represent community health centers. And community health centers are serving 466,000 people in the state of Louisiana. We're in 55 parishes, both urban and rural. We've been a part of the pandemic response from the very beginning. We've tested, I guess, close to 50,000 folks in our centers, as well as being a part of the community testing as it spread. The issues that we see in rural communities are exacerbated by a lot of social determinants of health. A lot of our folks don't have transportation. They don't always have easy access. You won't find a whole lot of people homeless on the streets, but we do have housing overcrowding, which makes it very difficult to socially distance when someone is diagnosed in a family and you have 10 people living in a one-bedroom apartment. So that's become a challenge for us. But we have been very diligent in working closely with the Office of Public Health, and Dr. Riggins is going to give you some statistics with that. But I can't emphasize enough as an internist, as a treating physician, the measures that have been put into place, that is the reason that we're having the success, not total success, but the success that we're enjoying for the last several weeks in terms of flattening and plateauing to a degree. Because people are wearing masks, it does make a difference, and they're practicing the social distancing and hand washing. One thing I want to mention also in a proactive sort of way, even though we're in a pandemic, we are still addressing the healthcare issues that resulted in the inequities that exist. And he mentioned the Health Equity Task Force under the leadership of Dr. Brown and Dr. Levis has been hard at work. We've been meeting on a regular basis and providing recommendations and studying data and strategies that can help us to continue to work our way out of this pandemic. One other thing I want to mention is that we are very aggressively promoting to the public to get fully immunized in anticipation of a second wave, if you will. So all the kids that need to be updated in their immunizations, I know it's required for schools, but we want to make sure that people know that you can do something actively to help as this process continues to play out. In the adult population, we're encouraging everyone that is susceptible to get their pneumonia shots. So that can be protection that you can have against pneumonia. And we're actively working on plans right now to do aggressive flu vaccination this year. Our rates have been historically underwhelming at like 46%, so we're going to push real hard massive flu vaccinations to help protect folks against that. And we're also looking at plans to, when the vaccine becomes available, that we'll have a strategy to make sure that we can get that out. So we're thinking ahead in those terms. And in respect to trying to think ahead, we can't underestimate the fact that we do have inequities in this state as it relates to hypertension, diabetes, and obesity. And we will never forget that those comorbidities are putting a lot of our people at risk. I want to mention one other thing we're excited about in St. Mary Parish. Teche Action Clinic was chosen, and in the next few weeks we'll be rolling out, we were awarded a grant to do 1,000 tests in the parish, working with the National Minority Quality Forum, where we'll be testing the residents in our clinics as well as the general public. It'll be a combination test that we'll be doing the nasal swab, the PCR test that gives you results within 48 hours that if you have active disease, as well as serology testing to see if you have antibodies. And people that agree to be in the study, we're also going to be doing genetic testing to see if there's a genetic basis for susceptibility for those patients. And we'll be talking more about that as we go on. I'd be happy to answer any questions that you may have regarding some of the challenges or anything that, that you wanted to bring up. So I'll open the floor.
Good afternoon. Thank you, Governor. Thank you, Dr. Wiltz. If I could prescribe one thing to my patients, which are the 7 parishes in South Central Louisiana, it would be a medical home and a mask, but a medical home for sure, a place where they could get their preventive care as well as care for any chronic diseases and the other wraparound services that our federally qualified health centers and rural health clinics are able to provide. This is Community Health Center Week, and I really appreciate the opportunity to highlight the work that they do on the front lines with our neediest in our communities. As a public health doc, as I said, I treat communities are my patients. I'd like to tell you the story of the pandemic through a couple of my patients. Just like individual patients, our communities are very different in their makeup, in their susceptibility, and in their response to this virus. And I'd like to highlight that in one parish that really looked like the first peak and was very much involved, which is St. John the Baptist Parish. And then I'll tell you about a parish that was a part of the second peak, much more like the rest of Louisiana. So if we could show that slide, please. Oh, St. John the Baptist Parish You see here in the blue line the cases by race. The blue line is in the black population, red line being in whites, and you see the dramatic difference there, both in cases and in deaths. And I might add, the governor said it very well, there is also nursing home data in this. And when you make the distinction between community deaths and nursing home deaths, these disparities get even more dramatic because we saw about 70% of deaths in nursing homes were in whites, and 70% of deaths in the community, much younger population, was in the African American population. So St. John the Baptist, when you see the spike there early, back in March and April, you may remember we were in the national news. St. John the Baptist Parish had a dubious distinction at that time. And at that time is when we reach out to our partners. And Dr. WILTZ, Teche Action Clinics stepped up. They opened their clinics to the general public. They served as the ordering physician for community-based testing. And their help made a big difference in turning the tide during that very threatening first peak. During the second peak in St. John, we continue to lean forward and to try to reach those most vulnerable, those with the most social determinants of health, difficulties with transportation, with housing, with food insecurity that puts them at risk. And so our work will never be done. Let's look at St. Mary Parish. St. Mary Parish was relatively spared, not completely, but comparatively spared during the first peak, as you see in these slides. The disparities were still apparent, and these are raw numbers, I might add. So, because about 38% of St. Mary Parish is black, if we had these as rates, you would see an even more dramatic disparity between cases. Deaths there, you see again the early death experience that affected us primarily in nursing homes, but certainly not limited to that. In January, we were working together with the Health Disparities Task Force, closely planning to spend 2020 together with the partners at the community level, knowing that we already had disparities in Louisiana. We were prepared to partner we were working with the chambers and the business community. We were working with our healthcare system, certainly, but also our schools and the faith community, and preparing to use data to really drive evidence-based interventions at the local level, when suddenly we found ourselves working together against a different foe. I think we have grown to know our schools better, our churches, our business community through this combined effort to prevent the spread of COVID-19. And I just hope that as we move forward and readdress the chronic diseases and the disparities that existed before, that we'll be able to resume that effort and together address the underlying causes that have led to these disparities. So thank you, and I'll take any questions.
Thank you, Dr. WILTZ and Dr. Riggins. And I do want to, before I forget, to remind everyone this year, whether you've gotten them in the past or not, you should plan to and actually get a flu shot this year. I think you may have seen over the past several weeks, but particularly yesterday, Dr. Redfield, who runs the CDC, was really talking about how there's a chance that this fall we will see continued surge or a new surge of coronavirus cases at the same time that you would have your normal flu season, and it could be abnormally high or whatever, and that together those things could overwhelm our capacity to deliver health care, because these are both conditions that cause respiratory problems, and so you put demand on the same part of your healthcare delivery system, and so in order to try to prevent that or minimize that, we are asking people to make sure that you get your flu shots this year, whether you have in years past or not. And they aren't yet available, but they will be in a few weeks, and we're going to have an extensive campaign to try to get people to get the flu shot this year. On Tuesday at the press conference, we talked a little bit about unemployment benefit assistance. You all know the $600 enhanced federal benefit expired on July the 31st, and by executive action on this past Saturday, the President signed a memorandum that seeks to continue enhanced unemployment benefits, but at a reduced level. There were a couple of options, one of which is we could accept $300 from the federal government, and we would have to match that with an additional $100 from the state. The President specifically asked states to use their CARES Act funding. We don't have any CARES Act funding left that we would be able to use here in Louisiana, and we don't have otherwise the money that would be required to put up as a match. So the second option we have is to accept a $300 benefit total enhancement package, all of it coming from the federal government. And if you recall, the question then was, would that be available to any unemployed worker who was getting less than $100 from the state in benefits? And last night, close to 8 o'clock at night, the final guidance came down on that, or what we believe is the final guidance, and they're going to allow us to take the entire amount that we're spending of state dollars across the universe of the uninsured population and average it out. And if the average is more than $100 per beneficiary, then the $300 is going to be available. So the good news today is we fully anticipate that all of the individuals who are getting unemployment benefits, and it's in excess of 400,000 individuals, that they are going to be able to get the $300 enhancement. It will be retroactive to August the 1st. It will not cost the state any additional funding. And so that really is the good news. There are some challenges around this. The funding, for the first time ever, is actually coming from FEMA, and it's coming from the Disaster Relief Fund, and that fund has $69 billion in it right now. This program goes away once $44 billion of that has been spent, because the President has determined that $25 billion needs to be there for the intended purpose of the Disaster Relief Fund, which we're very familiar with, and that is to prepare for, respond to, and recover from disasters. And with this being hurricane season, certainly we want to make sure that there's money that stays in that fund. But the $44 billion, while very much welcome, it is a stopgap piecemeal approach, because at the end of the day, looking at the drawdown rates on the $600 benefit, it should last nationwide somewhere around 5 to 6 weeks. Again, that's better than not having it, but and the good news is I think it gives Congress more time to deliver the comprehensive assistance that we need to get us at least through the end of the year. And I am continuing to encourage Congress to do exactly that. And it's very important that they come together. So we do have some good news. And I told you the other day that it's a function of when we get the funding, and that remains the case. We have already completed the grant application paperwork that we had to send in to FEMA. We designated the Louisiana Workforce Commission as the agency in Louisiana that's going to administer and be responsible for the program. And now we're continuing to work with FEMA and with the U.S. Department of Labor to get the funding just as soon as possible. What I told you on Tuesday about whether or not we had to go back and reconfigure at any part, in any way, I should say, the computer systems that actually run that program for the Louisiana Workforce Commission. It was partly right, and as it turned out, was partly wrong. For those individuals who are receiving more than $100 per week, nothing new has to be done, and that's about half of the population. For the others, there is going to have to be some changes so that they actually, their accounts get credited some of the overage in the others, and we're working with our vendor now to make that happen just as soon as possible. It's our hope and my expectation that we will be able to make the computer fixes before the funding is available, so that individuals are not having to wait longer than absolutely necessary to receive their next unemployment compensation check with those enhanced federal benefits. In the meantime, the state unemployment is going to continue to pay as it has. You should all be aware that the trust fund balance now for the state is $230 million. So it continues to dwindle down. That is a particular challenge, and we certainly need Congress, in addition to passing a more comprehensive, more permanent unemployment benefit, we also need more state aid and local government aid as part of that next package, with the flexibility to replenish the Unemployment Insurance Trust Fund and thereby avoid the need to borrow money and impose a surcharge on our employers, as is required by law now, in order to ensure that the federal government that we're going to be able to pay that back. As I mentioned before, nobody thinks, and I certainly don't think, that right now is a good time to be imposing a surcharge on our employers across the state of Louisiana. So we're working extremely hard on this. We also continue to work on the Title 32 situation. That's the National Guardsmen. You know, we have about 1,200 National Guardsmen on duty every single day, working in many, many ways that are critically important this public health emergency. And there's a lot of costs associated with that. The President did extend to the end of the year Title 32, but with a 75% match rather than 100%. And that 25% would require the state of Louisiana to come up with significant funding. The President has made a few exceptions for other states and kept them at the 100% level. We've re-urged him to reconsider and put Louisiana also 100%. And I think it's critically important and eminently justifiable, given that we have the nation's highest per capita case count, and that we were riding the crest of the first surge and the second surge. And if you look at the important work that the National Guard continues to do, obviously we can't do without them. And so we're asking them to certainly reconsider that. Also wanted to announce that the U.S. Department of Veterans Affairs is providing $400 million in grants to combat homelessness among veterans nationwide. The Louisiana Department of Veterans Affairs is supporting 5 nonprofit organizations that will receive more than $6 million of that funding. Veterans can contact the Louisiana Department of Veterans Affairs for more information. Again, so this is good news for homeless veterans, and we're asking them to contact the Department of Veterans Affairs. Additionally, staff can inform the veteran about the Military Family Assistance Fund, which provides up to $10,000 per year for financial hardships. If funding is approved, it can prevent homelessness, allowing the veteran to pay his or her rent or mortgage. So just a few additional announcements that we don't normally cover on these press briefings, and at this point I will take your questions.
This virus has been teaching us along the way, and most viruses tend to be calmer in the summer. This virus has not been. We showed that when you stayed home and kept away from being with a lot of folks and congregating, we were able to flatten that curve. When we started allowing people to go out and about, it put some people being exposed and spreading the virus. there was hope from the scientific community that the summer would slow down the virus and we would have an opportunity to get through the summer without all these infections. That virus did not behave the way these viruses normally behave. So the answer is we did everything we could to convince people to do the right thing as they went out and about, because obviously people weren't going to stay at home, continue to stay at home. They were ready to come out. Where we've lost some ground is when people didn't think they needed to wear a mask, didn't need to keep their social distancing. When they thought they were safe just because they were young, that was a false sense of security, and it helped this virus spread. So we've seen more spread because people were not heeding the advice, is what I've come to believe. And as we go into the fall and now school starting, it's even more important than ever that we're getting into flu season, that we follow the advice to slow down the spread till we have a vaccine, which we've been saying since the beginning of this virus. But this virus is not your typical virus this summer, so it really has caught the whole country off guard, but especially the southern states where we've seen outbreaks where people go out and about in the summertime, and we've seen outbreaks more in the southern states than we have in the northern states, which was not predictable by the scientists.
So I think Dr. GUIDRY is exactly right. There was a hope more than an expectation that the summer months with the higher heat and the humidity would slow the spread of the virus. But if you remember when the coronavirus came to Louisiana and to the United States, it was summertime down in Australia. They were, and that's just one example of where it was summer, and they saw the disease being transmitted, and so our experience here really wasn't different than it was there. It was more of a hope than an expectation. And as we move into the fall, one of the things that I want to reinforce to people that along with this need to get the flu shot, because we don't want for there to be a lot of flu cases while we have COVID cases, because they present demands on the same part of our healthcare delivery system. It is also true that the mitigation measures that reduce the transmission of the coronavirus also reduce the transmission of the flu. And we know that is not just a theory, because we were still in the flu season when coronavirus hit. And when we started asking people to social distance and stay at home and wash their hands and not shake hands and stuff like that, even though the coronavirus was taken off and people were coming to the hospital sick with COVID, the number of people who were presenting with the flu dropped precipitously. And so the mitigation measures that we're talking about will keep us much safer, not just as it relates to COVID, but also as it relates to the flu. But in addition to those mitigation measures, we do want and strongly encourage people to get a flu shot this year.
So we've been working for months with Department of Ed and Higher Ed, Public Health has, and giving advice on how to get into the school year. What is unpredictable is how parents are going to react to a child or staff. And so when you have all these plans, it's to do it as safe as possible. If people don't share the information because they're worried about how the information is used, if a parent has a child who has symptoms but they don't bring them in, and we don't know that they have COVID, and they send them to school sick, then there's a risk there. And so it takes all of us, the school system, public health system, and we have worked very closely together to say how we're going to get through this, and we plan for this, and school starting, and we're already seeing where some schools, a staffer's positive, they want to clean the school, they went back to virtual, and they're going to clean the school and keep the kids out till the end of the week. These are decisions that they're making with public health advice, but what's different, when you look at school systems in the past, when there's school absences, parents don't always report what they're due to. The school doesn't always know. They're absent because they had a virus. They had diarrhea. They didn't feel well that morning. They had a headache. So it's very hard to go into coronavirus with the way we used to do business, where it's not all reported. Certainly if parents know that the child was seen by their physician or their provider and they got tested and there's a positive test, that's definitely something we have to know about and we have to act on. If a child's sick for a few days and the parent doesn't really know if they have COVID or not, they should be checking either with their provider first or with the school, but they should be letting the school know, my child has these symptoms. Public health is going to be tracking the symptoms to say this might be a COVID case. We need to handle this a little differently. So this is getting to be, a lot of questions around school system, and the school system is doing a real good job with their superintendents and educating the teachers, but there's still a lot of unknowns of how the parents are going to react. Our advice might be there were 5 children in a class or 10 children that need to be quarantined. But the parents might say, I'm not sending my child to school. They were in the school, not in the class, not even exposed. We don't control everything, but we can give real good advice so that we don't shut down. Shutting down is not the answer unless there's a large number of students or a large number of teachers. But we have to have good information to give that advice. And that information has to come from the parents and the kids in the school system. And the school system is dependent on the parents reporting, much as we are with contact tracing. People telling us where they've been and who they might have contact with. We depend on that information to make decisions. That's how we contain the spread. School systems, it's a place where we've done a lot of work, but we still are dependent on the parents reporting and letting the school system know why the child's out and reporting, what's going on. Same thing with staffers. So there's no simple answer on this because we haven't done this in our lifetimes. This is something that hasn't been done before. So there's a lot of questions we're answering as we go, but I can tell you that I've never seen us work so closely with the school system as I have these past few months. It's been unbelievable in anticipation of doing this safely. I hope that answers your question. Not so much. I do know we're working with them on a reporting system where the school will report in to the office and we will be tracking it. But it's still dependent on information they get from the parent and the children. And this worry about sharing of personal health information, it's about protecting everyone. And it's not about trying to point fingers. It's about trying to figure out how to contain the spread. And it's going to take all of us to make sure that happens to stop spreading the infection. So I do know we're putting a system in place, and the governor has demanded we put a system in place that we can track this better than we do school absences, because on any given day, there are a lot of kids that are absent.
Okay, thank you. I want to thank all of you for continuing to cover this, and I want to thank the people of Louisiana because you really have made a difference. Over the last 2.5 weeks or so, we've really started to see improvement in our numbers of people presenting with COVID-like symptoms at hospitals, number of people that are testing positive, the percentage of tests that are rendering a positive result, the number of folks admitted in the hospital, and so forth. And so we just encourage you to continue. And when we do certain things that cause the situation to improve, when the situation improves, it's not reason to stop doing the things that caused the improvement in the first place. Otherwise, you're just going to go right back to where you were. So I'm asking people to be patient, understand that there's very much a new normal that will be with us until such time as there's a vaccine that's developed, and probably more than one, that's going to have to be safe and effective and mass-produced and actually administered to a significant percentage of our population. Until then, we're going to open as much of our economy as possible and strike the balance between that and public health. We're going to open our schools and our colleges and doing the same thing. But to be successful, we know what we have to do. We know what works. You can look at the data we've been reporting over the last 2 weeks now, and you can see that it works. Wear your mask, social distance, wash your hands, stay home when you're sick, reduce the crowd size that you're going into, reduce your activity. Don't go outside of your home more often than you need to. And if we will do these things, then we're all going to be safer. We're all going to be better as a result. And we owe it to one another. That is just common courtesy, being a good neighbor, that I don't do something that causes you to have an unnecessary and unreasonable risk of contracting a disease. And that we also owe it to our healthcare delivery professionals so that we don't continue to overburden them. They have been working nonstop, heroically, for months and months and months now, dealing with the extreme patient loads, all while they are living in our communities that have all this COVID too, and they're contracting the disease themselves. So let's all pull together, be good neighbors, and I want to thank everybody for what they have done. Encourage you to continue to have patience, see the results that we've been able to obtain, and for those individuals who have yet, for some reason that I quite frankly cannot begin to understand, if you haven't adhered to the mask mandate, I'm asking that you do so. If you haven't seen the need to physically distance yourself from people who are not part of your immediate household, I'm asking that you do so. If you haven't refrained from leaving the house when you're sick, I'm asking that you stay home when you're sick. Those are the things we're all going to have to do. And if we will all do them, we're going to be successful. And success is still going to look like some people getting COVID, some people going to the hospital, and unfortunately, some people dying. But we don't have to report 41 deaths a day, or 50 deaths a day, or 61 deaths, whatever it is we've been reporting over the last several weeks. So this literally is about saving people's lives. And when you look at it from that perspective, it is an insignificant request to just put your mask on. And so I'm asking people to do that. I will see you all on Tuesday at 2:30 for our next scheduled press briefing. And obviously, if something comes up and we need to get with you sooner than that, we will. Sam, we owe you an answer. We'll get that to you very shortly.